Hi, my name is Wendy. I'm the Grassroots Advocacy Officer at the United Nations Foundation Nothing But Nets campaign. And in this session, we're going to talk about the vast continent of Africa and how programs on the ground are innovating to defeat malaria. Africa continues to carry the lion's share of global malaria burden. In 2019, the continent was home to 94% of all malaria cases and deaths. Incredible progress has been made on the continent to reduce cases and deaths, thanks to in-country leadership, significant investment from partners such as the Bill and Melinda Gates Foundation, the Global Fund, PMI, WHO, and UN agencies. Life-saving tools created by private sector partners from nets to treatment, and the tireless energy of the heroes fighting malaria on the front lines. However, that progress has stagnated due to challenges such as insecticide resistance, insufficient resources, reduced commitments, and now COVID-19. Now more than ever, innovation is required to battle one of the oldest and deadliest diseases known to humankind. People in programs on the malaria front lines in countries such as Uganda and Benin are proving that while malaria parasite is smart, we are smarter. First stop, Uganda, where one of the most vulnerable populations to malaria is fighting back. Uganda ranks 8th in number of malaria infections in sub-Saharan Africa and has some of the highest reported malaria transmission rates in the world. Dr. Jimmy Opaigo, the head of the Malaria Control Program at the Ministry of Health in Uganda, talks about how his country is working to change that.
On behalf of the Ugandan people, we keep extending our appreciation to the American people for the support we keep receiving over the years to fight malaria. The funding and technical support we have received from the President's Malaria Initiative, of course rooted from the American people, has seen us reduce malaria prevalence in Uganda from 42% in 2009 to 19% in 2014, and now a single digit 9% in 2019. We are now positioned to go to less than 5% and move towards elimination. So it's very promising, is a resource well used and very much appreciated. We know this support from the American people comes not only through the President's Malaria Initiative, but also CDC, Department of Defense, National Institute of Health, and a very substantive one through the Global Fund. When you go to any hospital, and this hospital we are looking at, you can see the support we have received in terms of commodities, supplies, life-saving action, which restore life and health of those the children who would have otherwise lost. Now, with the turn of COVID, we expected the worst, as COVID disrupted the health system, disrupted livelihoods, disrupted public transport, and so people could not seek care. It even scared people to touch anybody with fever, which malaria also presents with. Fortunately, we worked very quickly with our partners, especially the President's Malaria Initiative, to ensure that we continue services, essential services, the challenges notwithstanding. To make it possible for our community health workers to operate even within COVID, they were provided quick training, they were provided PPE to protect themselves, to enable our field teams deliver the much needed residual indoor spraying within COVID, because there has been a deliberate focus on saving lives, deliberate focus on children, deliberate focus on mothers, the most vulnerable people. But just not only saving lives, but also building competence among communities through malaria smart schools. In the malaria smart schools, we are focusing on building a malaria prevention culture among the children, but also building the children to be change agents to their homes, so that they drive change sustainably and impactfully in our communities. As we continue in the going years, the Ugandan people do not take all this support for granted. And we look forward to continued support to save lives, but we can only demonstrate our appreciation by using every dollar properly and accounting for every penny. And we can further demonstrate our appreciations by saying, God bless America. As I end, I would like you to take a look at what actually happens in our hospitals.
I'm Dr. Tumsime Fred Katakanya. I'm medical superintendent at Yantonde Hospital. This is how we handle our patients for clients. As soon as the patient enters, they are screened for COVID-19. At OPD, as you can see here, this is where we do triage. Those who are very sick, immediate patients, they are handed over to the doctors and clinicians for immediate interventions. From this table where the triage is done. Very sick patient, taken to emergency room. These are the patients. You can see this is doctor's room. And we have our emergency rooms. This is our emergency room. Though it is small, but this is our emergency room. You can see these are the very sick patients who cannot wait. This is our store for our medicines. You can see the compartment for antimalarials. This is our dispensing window. These are the staffs. They are serving patients. Yes. So this is our laboratory department. In the laboratory department, so far we have some statistics. In 2015, our testing rate was 68%. As of 2020, the testing rate is now 99%. When you look at in 2015, the positive cases of malaria were at 28%. In 2020, the positive cases of malaria were at 12%. This is so far the figure we have. This is our antenatal care clinic for mothers who are pregnant. In 2015, malaria in pregnancy was 1,257. And in 2020, we had 48 mothers who had malaria. Yeah, this is the entry to pediatric ward and female wing. In this department, we have two sides. One is for children, for pediatric. Another one is for female. Any patient that comes, after admitting this patient, we provide each bed is provided with a mosquito net to protect this patient from malaria infection. So any patient is encouraged to sleep under mosquito net, and the staff take the responsibility and initiative to make sure that this patient sleeps under mosquito net. I'd like to appreciate in a special way the Yantonde General Hospital staff for the commitment they have always exhibited and the determination they have put in to make sure they reduce the cases of malaria in our district, especially among the pregnant mothers. And also, I want to encourage the staffs to always teach, sensitize the public and the mothers who come to antenatal clinic the benefits and advantages of sleeping under mosquito nets. That it protects them and it protects them from losing the pregnancies as well, because malaria is one of the causes of the miscarriages and abortion. So I encourage the staff to always remind and sensitize the public and the mothers to always sleep under mosquito nets. Yes, and with those words, members, I thank you so much for their commitment. I thank you so much for the service rendered to the community. May God bless you so much.
Thank you to Dr. Jimmy and the PMI team in Uganda for giving that first-hand look into what's happening on the malaria front lines. The efforts of PMI and other partners like Global Fund are critical to saving lives. This map represents cases in Uganda for 2019. Children under 5 years of age continue to represent a disproportionately high share of the malaria burden. In 2019, 274,000 children around the world died from malaria, making up to 67% of all malaria deaths. In Uganda, 20 to 30% of all pediatric admissions to hospitals are due to malaria and severe anemia, which is often due to untreated malaria and continues to plague health centers across the country.
You're welcome to Walioba, a malaria smart school.
Ugandan school children are fighting to change that. At the Walioba Primary School, a malaria smart school, as you just heard, a student named Ayaturn mentioned, students are battling malaria head-on through song, dance, and art. This school is located in western Uganda and is supported by the President's Malaria Initiative MAPD project. In every classroom, you'll find a malaria corner filled with student-drawn information about the disease, causes, and prevention methods. This is Ayaturn Admani, the student you heard from earlier, and he takes us through one of the materials in his classroom's malaria corner.
How Anopheles mosquitoes spread malaria.
The school's headmaster, Biona Ntairaho, has worked as the district's music instructor for nearly 20 years and specializes in music to foster learning. In the background, you can hear one of the performances Biona helped produce. As part of the project, students received a free bed net, which can protect them for up to 3 years. Armed with nets and knowledge, these students act as behavior change agents in their homes and wider communities. And that's what the PMI MAPD project was meant to do. Take the students' malaria education beyond just the classroom and build a brighter future for Uganda's children. The benefits of ending malaria extend beyond just good health. Reducing malaria enables children to attend school regularly and learn more effectively. It can significantly improve their school performance and later wage earning capacity. Ending malaria would have a significant impact on girls and women. Women and school-age girls are often the caretakers for their sick loved ones. Without the burden of malaria, they can focus on other activities like completing school, entering and remaining in the workforce, and participating in public decision-making. Club advisor Rebecca Ija Okole works with participants alongside Biona to compose unique songs, poems, and dances designed to educate their peers and community members about the dangers of malaria. Watch as students perform one for their community.
The massless female Anopheles mosquito that bites people using their sharp proboscis, all the way from bushy areas, broken bottles, and stagnant water, sucking blood from infected and uninfected persons, with the aim of making its eggs to mature. Every day, innocent people are infected with malaria, having fever, headache, vomiting, and joint pain. Some are admitted in hospitals, while others lose their lives due to malaria. This is our advice to you all. Sleep under treated mosquito nets. Clear the bush around the area of residence. Dispose of containers where mosquitoes can breed. Spraying with insecticides. All this to prevent the increasing spread of malaria. For God and my country.
The club's 40 student members, ranging in age from 6 to 15, have performed at school assemblies, parent meetings, and the local market. But they're not stopping there. The project utilizes a peer-to-peer approach, where Malaria Smart Schools help other nearby schools set up their own health clubs. Through the Malaria Smart School model, these children are empowered to take the fight against malaria into their own hands. So watch out, malaria. These kids have nets and they know how to use them. With smart and creative, passionate champions like these, we can be the generation to end malaria. Now we're headed to Benin, where a new innovative bed net distribution strategy is addressing the challenges incurred by COVID-19 head-on. Benin is faced with one of the highest burdens of malaria in the world. Their population of just over 12 million people faces 2 million malaria cases a year. On this tour, you'll hear music produced by Angelique Kidjo, a Beninese American, Grammy Award singer-songwriter, UNICEF Goodwill Ambassador, and an activist who raises her voice to help end malaria. We all saw how COVID-19 challenged health systems in 2020, and this was no exception in Benin. Surveys from the Global Fund supported programs across 106 countries showed COVID-19 led to widespread disruptions, impacting approximately 3/4 of malaria programs. Delays in mosquito net distribution put vulnerable populations at risk and could lead to a significant spike in malaria cases and deaths. And as we all witnessed, some of the most vulnerable people to disease and death are health workers themselves. Testing and treatment for malaria depends critically on their availability, and COVID-19 means that they may be unable to travel, are sick themselves, or don't have the proper PPE to protect themselves. These hurdles didn't stop the government of Benin or supporting partners like the Global Fund and PMI from adapting their bed net distribution in order to protect the most vulnerable. As you can see in this photo, a normal bed net distribution requires a mass gathering at a fixed point in the community. The threat of COVID-19 meant that this strategy had to shift. For the first time, community health workers in Benin went door to door to distribute more than 8 million mosquito nets across the country. About 5,500 community workers completed this in just 20 days. Can we just stop and think about how amazing that is? 8 million mosquito nets in just 20 days. That meant that almost the entire population of Benin is now protected with the delivery of these nets. This was done in close collaboration with Benin's National Malaria Control Program. But door-to-door delivery of bed nets are not the only innovation in Benin. We're going to show you a video of how the government of Benin is tracking bed net distribution in partnership with the Bill and Melinda Gates Foundation, Catholic Relief Services, and the Global Fund.
Since the year 2000, deaths from malaria have been reduced by more than half. One of the reasons why is the use of insecticide-treated bed nets, which protect people from mosquito bites at night. But more needs to be done to ensure everyone at risk of malaria has access to them. In Benin, a new innovative bed net distribution program promises to improve bed net coverage, reduce malaria transmission, and save lives.
Chaque année au Bénin, nous avons environ, dans la population générale, on a environ 2 millions de cas de lutte qui sont mis en place au Bénin. Mais cependant, les cas augmentent. On a environ 3500 décès et chez les enfants, ce chiffre va tourner autour de 2500 décès par année. Donc dans cette lutte-là, la moustiquaire imprégnée joue un rôle capital. Le pays fait une campagne de distribution de masse. Ils savent déjà que tous les 3 ans.
The idea is to have every person in Benin have access to and sleep under an insecticide-treated net. It repels the mosquitoes, but also kills them if they land on the net. You diminish the population and the lifespan of the mosquitoes. Therefore, you diminish the transmission burden as well. In the past, these massive bed net campaigns had paper-based systems to register households and eventually distribute these nets. The paper-based systems are actually very expensive to conduct and are often far from accurate. And now many of the activities that formerly occurred on paper are now done in a digital platform through a smartphone.
Les volontaires sont ceux-là qui sont sur le terrain, les équipes déployées sur le terrain pour faire le recensement. Donc on a les informations telles que la taille des ménages, le sexe, l'âge des enfants, les femmes enceintes.
The household will receive this QR code-enabled coupon that they take to a distribution site. The coupon is scanned by the health worker, and it immediately indicates the number of nets that they should be receiving. All the information goes into a database in the cloud, and it presents an immediate way of actually identifying problems or issues. Supervisors then can go to those spots where they're seeing difficulties and try to address them right away. It really improves the efficiency of the entire process. Digitized mass bed net distribution saves more lives, it saves more money, and it saves more time.
Le programme de digitalisation nous permet pour avoir une bonne couverture des ménages qui nous permettront quand même de réduire les cas du paludisme et pourquoi pas, comme d'autres pays également, aller à l'élimination.
And this initiative will make a difference not only for malaria but for other health campaigns. It's really exciting to see what this is doing now and what it really could do in Benin in the future.
Benin's commitment to reaching the last mile is a guidepost to how other programs can ensure a bednet reaches the hands of everyone who needs one. In a year filled with so many challenges, 5,500 community health workers in Benin covered thousands of miles to ensure no one in their country had to worry about the threat of a mosquito bite. We think that's something worth celebrating. Now, I would like to take the time to thank one of our sponsors for this event, SC Johnson,